Good morning, students. We will continue chemistry of lipids, competency number 4.1, and today's topic is functions and biological importance of hormonal steroids. As discussed in the previous lecture, the steroid hormones are derived from cholesterol. There are three main groups of steroid hormones: glucocorticoids, minerlocorticoids, and sex steroids. In short, we will see the synthesis of steroid hormones because it is not in your syllabus. First, cholesterol is converted into pregnenolone with the help of enzyme desmolase. This enzyme desmolase is stimulated by ACTH, adrenocorticotropic hormone, synthesized by the pituitary gland. This pregnenolone is converted into progesterone, from which mineralocorticoid and sex steroids are synthesized later on, whereas glucocorticoids are synthesized from pregnenolone. So this is in short about the biosynthesis of steroid hormones. Here the ACTH stimulates the desmolase enzyme in the first step, and that step is the rate limiting step of steroid synthesis pathway. As these steroid hormones are lipid soluble, they can travel through the cell membrane, enters into the cytoplasma. Therefore, they have intracellular messengers. They bind with the receptors present in the cytoplasma, and then they directly act on nucleus, DNA, and stimulate the process of transcription and translation. Important steroid hormones are these glucocorticoid, mineralocorticoid, and sex steroids. Their examples are given here. Examples of glucocorticoids are cortisol, cortisone, and corticosterone. Important examples of mineralocorticoids are aldosterone, 11-deoxycorticosterone, and corticosterone. Important examples of sex steroids are testosterone, estrogen, and dihydroepiandrosterone. We will see the functions of each. First, we will see the functions of glucocorticoids on carbohydrate metabolism. Glucocorticoids generally increases the blood glucose level, which is called as hyperglycemia, by various mechanisms. And the first and important mechanism is gluconeogenesis, means formation of new glucose molecules from non-carbohydrate source. And how they will stimulate this? By stimulating the enzymes of this pathway. Next activity is they decreases the process of glycolysis. All of you know glycolysis is the process which utilizes glucose. So it tries to decrease the blood glucose level. But the function of glucocorticoid is they try to increase the blood glucose level. Therefore, they inhibit the glycolytic pathway by inhibiting its enzyme. And the third mechanism is they decrease the glucose uptake by the peripheral tissues, which also helps in increasing the glucose level. So glucocorticoids are hyperglycemic hormones. On the lipid metabolism, glucocorticoids causes increased mobilization of lipid from adipose tissue. They stimulate the lipolytic hormones, which break the lipids, and it will lead to hyperlipidemia, means increase in the lipid level of the blood. On protein metabolism, they stimulate the process of transamination, in which amino group from one amino acid is transferred to another amino acid. After transamination, it causes catabolism of amino acid to form urea. Glucocorticoids also brings catabolism in the nucleic acid, leading to increased uric acid production after their breakdown. Glucocorticoid promotes water excretion by increasing the GFR, glomerular filtration rate, and by inhibition of ADH secretion, antidiuretic hormone secretion. They decreases the serum calcium by inhibiting the osteoblast function, leading to osteoporosis. So they decrease the bone density. Glucocorticoids also stimulates the secretion of gastric acids and enzyme in the stomach, leading to acid peptic disease. Glucocorticoid impairs collagen formation. They also interfere with healing of the wound, leading to delay in the healing. Glucocorticoids suppresses the immunity, so they are called as immunosuppressant. They causes lysis of lymphocytes. Therefore, they can be used as an anti-allergic drugs or anti-inflammatory drug due to their effect on immune system. After glucocorticoids, we will see the functions of mineralocorticoid. Aldosterone is the main mineralocorticoid. The details of the functions of these glucocorticoids you will study in physiology. Just we will study the main function. Aldosterone increases the absorption of sodium from distal convoluted tubule in exchange with potassium. That means it absorbs sodium and secrete potassium outside the tubule. That means gain in sodium and loss of potassium occurs due to action of this aldosterone. Now, functions of sex steroids. Estrogen, the main important estrogen is estradiol. It is a predominant sex hormone present in females. It is also present in males in low levels. Estradiol has impact on reproductive system of female, sexual functioning. It also affects the other organs like bones, where it causes mineralization. Androgens, mainly found in males, stimulates spermatogenesis. They produces hypertrophy of prostate, seminal vesicles, muscles, due to which the males will have masculine body, bones and kidney cells. They are also called as anabolic hormones. Coming to the clinical importance of androgens, the testosterone is converted into dihydrotestosterone by an enzyme called as 5-alpha reductase. This dihydrotestosterone is responsible for benign enlargement of prostate, which is seen in 75% of the men above the age of 60. A drug called finasteride, which inhibit the 5-alpha reductase activity, leading to inhibition in the conversion of testosterone to dihydrotestosterone, and the prostate hypertrophy may be decreased, or you can say the size of the prostate gland decreases due to deficiency of dihydrotestosterone. Now we will study the assessment of adrenal function. So adrenal gland is under the control of pituitary gland. which is in turn under the control of hypothalamus. So all of us know hypothalamus synthesize a hormone called as corticotropin releasing hormone, which acts on pituitary and stimulates the pituitary. In response to this, pituitary gland stimulates a hormone called as ACTH, adrenocorticotropic hormone. Now this ACTH acts on adrenal gland. In response to it, adrenal gland will synthesize another hormone called as cortisol. Now this cortisol, after its secretion, it acts on pituitary gland and inhibits the pituitary gland by negative feedback mechanism. This cortisol also acts on hypothalamus and inhibit the hypothalamus and its secretion by the mechanism called as negative feedback mechanism. For adrenal function assessment, we have to perform some tests. Out of this, first test is measurement of basic level of cortisol. So cortisol level is determined by three techniques. First is radioimmunoassay. This technique is nowadays outdated because it requires radioactive material. The second and the important technique is ELISA. All of us know that it is a enzyme linked immunosorbent assay, and the new technology which is developed nowadays, which is very sensitive and accurate, is called as chemiluminescent immunoassay. This cortisol is present in blood in very small quantity and it shows diurnal variation. The cortisol level is highest in the blood at 9 am in the morning, which ranges from 5 to 25 microgram per deciliter, and its level is minimum at 10 pm in the morning, where its range is from 2 to 5 microgram per deciliter. In case of adrenal dysfunction, there is loss of diurnal rhythm of cortisol secretion. Next test which will assess the adrenal function is estimation of urinary free cortisol. Steroid hormones are excreted through the urine, and estimation of this free cortisol in the urine is a sensitive index of adrenal activity. That means it gives us idea about the secretion of cortisol in the adrenal gland. In hyperfunctioning of the adrenal gland, the cortisol excretion in the urine is more, and vice versa in the hypoactivity of the adrenal gland. In the urine, the urinary steroids are present in the form of either 17 ketosteroids or 17 hydroxysteroids. This 17 ketosteroid is derived from adrenal steroid as well as from androgens, whereas 17 hydroxysteroid is directly derived from adrenal steroids, that is glucocorticoids and minerlocorticoids. These urinary steroids are measured by different methods. Zimmermann reaction measures 7 ketosteroids, whereas Porter-Silber reaction will measure the 17 hydroxysteroids in urine. Another test for estimation of adrenal function is ACTH stimulation test. When adrenocorticotropic hormone is given to the normal person, it increases the cortisol secretion by the adrenal gland by stimulating the adrenal gland. Next is dexamethasone suppression test. In normal persons, when dexamethasone is given, this dexamethasone is an artificial steroid. It has action similar to cortisol, So when this dexamethasone is given intravenously to a patient, it negatively acts on the pituitary gland and inhibits its secretion just like cortisol. Therefore, due to decreased secretion of ACTH, there is decrease in the stimulation of adrenal gland, leading to decreased cholesterol synthesis in normal persons. In normal persons, if you give 2 milligram of dexamethasone, it will lead to fall in 50% of the cortisol level of the blood. In case of adrenal hyperactivity, this dexamethasone suppression test or suppression of cortisol level on administration of dexamethasone is not seen, because dexamethasone acts by inhibiting the ACTH secretion. In case of adrenal hyperactivity, adrenal gland is not responsive to ACTH secretion. Next is CRH stimulation test or corticotropin releasing hormone stimulation test. Here intravenously CRH is given to the patient. This CRH acts on pituitary gland and increases the secretion of ACTH. This ACTH in turn acts on cortisol and the level of cortisol is increased. So here if we measure the cortisol level after giving CRH, its level is increased. But in case of dexamethasone test, the cortisol level is decreased. Hyperfunctioning of adrenal gland is seen in Cushing syndrome. It is also called as primary disease because here the defect is in the adrenal gland. There may be adenoma or hyperplasia of the adrenal gland, due to which adrenal gland will synthesize more cortisol and it is not responsive to ACTH. Now the secondary causes of increased cortisol secretion are Cushing's disease. In secondary means here the defect lies outside the adrenal gland. In primary cause, the defect is in the adrenal gland. So here the adrenal gland is normal, therefore it is responsive to ACTH. The secondary causes are Cushing's disease or ectopic ACTH production. Ectopic means misplace. Here ACTH is produced not by pituitary gland but by other cells present in any part of the body. So in this case, this ACTH is not under the control of hypothalamus or CRH. It will synthesize its own ACTH, but this ACTH acts on adrenal gland, which is normal, and in response the adrenal gland will synthesize more cortisol level, leading to adrenal hyperfunction. So this chart shows you the various primary and secondary causes of adrenal functions. First is adrenal adenoma. It is a primary cause of adrenal hyperfunctioning. That means here adrenal gland is defective or there is adenoma. Adenoma means benign tumor of adrenal gland. Therefore adrenal gland will synthesize more cortisol and this is not under the control of ACTH. Now in this case, if we measure the plasma cortisol level, it is increased and the diurnal variation in the plasma cortisol level is not seen. Second, if we perform urinary free cortisol level, in this case it is also increased. Now if you perform the plasma ACTH test, ACTH level is decreased because of negative feedback inhibition by the increased cortisol level. Now, if you perform a dexamethasone suppression test, in this case, there is no suppression in the cortisol level with low doses of dexamethasone is seen. That means after giving the dexamethasone, there is not decrease in the cortisol level of the blood. Why? Because dexamethasone suppression test acts through pituitary gland. It will inhibit the pituitary gland and its secretion ACTH, but in the primary cause, that means in the adrenal adenoma, adrenal gland is not responsive to ACTH secretion. Therefore, there is no effect of dexamethasone suppression test in this case. The second primary cause is adrenal cancers or carcinoma. Here again the adrenal gland synthesizes its own cortisol hormone without any stimulation by ACTH, and it is not responsive to the secretion of ACTH. So if you measure the plasma cortisol level, in this case the plasma cortisol level is increased and diurnal rhythm is also lost. If you measure the urinary cortisol level, it is also high. Again the plasma ACTH level is decreased due to negative feedback inhibition of high cortisol level on pituitary gland. Here if you perform dexamethasone suppression test, there is no suppression of cortisol level is seen even with high doses of dexamethasone. The mechanism is similar to the mechanism just I have explained in adrenal adenoma. Another cause of increased adrenal function is pituitary adenoma. Here the adrenal gland is normal but pituitary gland is defective. So when there is defective pituitary gland, it will synthesize more and more ACTH. This ACTH will stimulate the adrenal gland and hence plasma cortisol level is increased in this case. Again the diurnal variation in the cortisol secretion is lost. Urinary cortisol level is also increased due to increased cortisol secretion. If you measure the plasma ACTH level, here the plasma ACTH level is increased because there is pituitary adenoma. In this case, if we perform dexamethasone suppression test by giving dexamethasone in high dose, then this dexamethasone will inhibit the pituitary gland to some extent and decrease in the cortisol level is seen. The third cause is ectopic ACTH production. That means production of ACTH by a cell other than pituitary gland. This ACTH has same action as that of ACTH of pituitary. It acts on adrenal gland, stimulate it to synthesize more cortisol level, so plasma cortisol level increase and there is loss of diurnal rhythm. If you measure the urinary free cortisol level, it is also increased. If you measure the plasma ACTH level, it is also increased. Here the source of increased ACTH is not pituitary gland but the cells other than pituitary gland. In this case, if you give or if you perform dexamethasone suppression test, there is no suppression in cortisol level because this dexamethasone does not act or does not have any effect on the cells, ectopic cells, which synthesizes ACTH. So these are the tests which helps us in the diagnosis of various adrenal hyperfunctions. Next is adrenal hypofunction, means decreased functioning of adrenal gland. Here the cortisol level is low. The primary cause is Addison's disease. It is also called as primary adrenal insufficiency. Here the defect is in the primary adrenal gland, which synthesizes less cortisol. Then sometimes the cause may be secondary due to disease of pituitary gland. Here ACTH secretion is decreased, therefore stimulation of adrenal gland is decreased, leading to decreased cortisol synthesis. In this secondary cause, the adrenal gland is normal and it is responsive to ACTH. Sometimes, very rarely, the hypothalamus is defective, which synthesizes less CRH, which stimulates pituitary gland and decreased synthesis of ACTH is seen, which decreases the synthesis of cortisol. So in the secondary and tertiary cases, the adrenal gland is normal and it is responsive to ACTH secretion. So this is the chart showing adrenal hypofunctioning. So primary cause, secondary cause and tertiary cause. Primary cause means here the adrenal gland is defective. Just I have to show you the disease name as Addison's disease. Here the plasma cortisol level is low. Urinary cortisol excretion is also low. But plasma ACTH level is elevated due to no negative feedback inhibition by cortisol. So ACTH will try to stimulate the adrenal gland. So it will synthesize more and more ACTH. In this case, if you give ACTH or if you perform ACTH stimulation test by giving external ACTH to the patient intravenously, this ACTH have no effect on adrenal gland and there is no increase in cortisol level is seen. So there is no effect of this test on cortisol level is seen. Now if you give CRH stimulation test, in this case it also has no effect because this CRH will stimulate the pituitary gland, which will synthesize more ACTH, but that ACTH is ineffective on adrenal gland. So adrenal gland does not respond to this ACTH level and there is no increase in the cortisol level is seen. So in this case, due to less cortisol level, the absorption of sodium is decreased, leading to decreased sodium level in the blood. As the potassium is not secreted, the potassium level is increased. Now coming to the secondary cause, here the pituitary gland is defective. It synthesizes low ACTH molecule, hence there is less stimulation of adrenal gland and hence plasma cortisol level is low. Here adrenal gland is normal and it is responsive to ACTH. Low cortisol means low urinary cortisol level is seen. In this case, if we measure the plasma ACTH level, the plasma ACTH level is low because the pituitary gland is defective. If you give or if you perform ACTH stimulation test by giving ACTH intravenously to the patient, then you will find that there is exaggerated increase in the cortisol level. Means as soon as you give the ACTH from the external source, it acts on adrenal gland and stimulates the secretion of cortisol. So you can see either normal cortisol level or more cortisol level after giving the ACTH stimulation test. Now if you perform CRH stimulation test in secondary case, so this CRH which is given externally intravenously act on pituitary gland. As the pituitary gland is defective, it does not respond to the CRH and there is no synthesis of ACTH and hence the cortisol level is not affected. Again here, due to deficiency of cortisol, sodium level decreases and potassium level increases. Now coming to the tertiary cause, here the hypothalamus is defective. Therefore, there is less synthesis of CRH, less stimulation of pituitary gland, less synthesis of ACTH, less stimulation of adrenal gland and hence less secretion of plasma cortisol. If you measure urinary cortisol level, they are also very low. Here plasma ACTH level is low because less synthesis by pituitary gland, but pituitary gland here is normal and responsive to CRH. Now in this case, again if you give or if you perform ACTH stimulation test, that means if you give ACTH intravenously to the patient, this ACTH acts on the adrenal gland which is perfectly normal, stimulate that adrenal gland and the adrenal gland will show increase in the synthesis of cortisol to the normal level, or sometimes the cortisol level is above the normal level which is called as exaggerated response. Third, if you perform the CRH stimulation test in this person, that means if you give external CRH to the patient, then this CRH acts on pituitary gland, stimulate it to synthesize more ACTH. This ACTH will act on adrenal gland which will synthesizes more cortisol level and you will see the exaggerated increase in the level of cortisol level. Coming to the sodium potassium level, it is also same. Due to deficiency of cortisol, there is decreased sodium level and increased potassium level of the body. So this is about the biological importance of hormonal steroids. Thank you very much.